I'm Cara Walz. I'm a nephrologist in St. Paul, Minnesota. The challenges we had related to infection management were the usual ones that dialysis patients have, bloodstream infections, typically related to catheters. I think the biggest challenge is getting rid of catheters, and then the infection rate decreases from there. What was successful was streamlining the process and reducing the number of CVCs. What wasn't successful was having CVCs, and I think I actually had to change my thinking on that throughout the years. I really thought that every center is going to need to have a certain CVC rate. I actually thought the goals that were the metrics that the government and DaVita was putting out in terms of CVC rates were pretty aggressive. I didn't know if we'd be able to attain those, but we actually have, and I think some of it had to do with my changing my thinking on CVCs. I now think about them as temporary. I talk to the patient very initially about that this is temporary. It's not something you're going to have forever. You need to get either an internal vascular access or a PD catheter, and that's really reduced the rate of the CVCs. So there will always be patients that have to have a catheter, and whether it's they've exhausted access sites or they're too medically sick or just the various reasons that a patient would have to have a CVC. There's always going to be patients that have to have those. And certain patients will then be plagued with infections or recurrent infections. And one thing I would do for a patient that did have to have a long-term CVC is a staphylococcal decontamination procedure. Some of my infectious disease colleagues help me with this, and it involves 3 to 5 days bathing with Hibiclens. The patient is doing this, and then also applying Bactroban to the nares for 3 to 5 days. And that just decreases the Staphylococcus count on a patient's system, and then can reduce the amount of infections. The advice I'd have for my peers is to work closely with your team at the center. They're the ones that are going to be helping you identify infections. And then I do think trying to prevent CVCs, and specifically by having a really good relationship with the surgical team, is really important.